A very good morning to everybody out here. Welcome to We Women Want Conclave 2025. And a very warm welcome to all my panelists over here as well. Post the COVID pandemic, we realized that people started to focus a lot on their health. Just after that, we also noticed that people started to worry. Mike. Hello? Sorry. And post the pandemic, we also noticed that what people started to do was talk about body positivity. It is, if you're plus size, but you feel healthy, it is all good. But recently, we've seen a change. You get a magic drug for weight loss called Ozempic, and everybody wants to get onto it. Well, is it healthy or is it not? Let's find out. Let's talk to our experts here to understand better. I'd go across to Anjali first. Anjali, you're a doctor. You know, tell our viewers here and the ones watching us on television, is Ozempic okay for everyone to take? Because everybody wants to just pick it up from the counter by themselves.
I think Ozempic is a great drug which has come at a time when India is really struggling with obesity and diabetes. It's not meant for everybody, but it's meant for people with diabetes and who have obesity. So if you don't have diabetes and you're using Ozempic just for a 5 kg, 6 kg weight loss, it's completely, it's wrong. Not only ethically it's wrong, it's medically wrong, it's physiologically wrong. So yeah, Ozempic has its set of patients where it can be used, and other patients, and fad-wise Ozempic is totally a no-no.
Ishi, I know your point of view when it comes to Ozempic. We've had this conversation earlier, but I would want our viewers to understand this because it's very important. What you talk about is muscle loss, what happens due to Ozempic. Can you explain that to viewers? Like, how is it really harmful? Like Dr. Anjali explained, if you have diabetes, especially it's meant for diabetic patients. If you're obese, yes, can be a solution, but just because you want to lose weight, look thin, you should not go on Ozempic.
Yeah, I think the point that you brought up about muscle loss is very, very important for us to understand one of the side effects among many. And we already in India have an issue of sarcopenia. And if we begin to lose muscle because of weight loss drug, it's something to reckon with. And so I'm not saying that the drug is bad or good, but what I'm saying is it has to be taken with a lot of caution, and who is going to take it, and whether the risks outweigh the benefits or the other way around. So that is extremely important because there are serious risks. And muscle loss, one of the mechanisms the drug works is that it just reduces your ability to eat food. And also it somewhere changes the way your body's the hormones and the neurotransmitters and the digestive juices. There's some change physiologically that it does. And I know of patients who have been taking them and they're just not able to eat that kind of protein. And so I don't know what are the other mechanisms, but what I see is this patient who was a hardcore meat eater. I mean, he wouldn't eat anything without, that was not his, vegetarian was not his food, it had to be non-veg. And about 3 months into Ozempic, he feels sick with the thought of food, with the thought of meat. And he's become totally vegetarian. So what I'm saying is whether it's the depleted intake or whether it is some other physiological, which are there mechanisms, but sarcopenia is a big issue. And the other side is that when you give up the drug, you will regain fat. Okay. So that's counterproductive again.
I see Sakshi here, completely agreeing with everything that you're saying. Sakshi, can you expand on that? And also, it's just not Ozempic. There are many more drugs now that are in the market, and people are just wanting to just pick it up and use it all by themselves without any reference from the doctor or any dietitian or a nutritionist.
So yes, I have a very, very blunt and very simple funda in this, is that people are telling and people are saying that all these drugs, Ozempic and all, are miracle drugs. But for me, they are basically chemical anorexia, which are masked as healthcare products. So I think that they trick our bodies into starvation. And they, like GLP-1 or the semaglutide, which is in the Ozempic and Mounjaro, etc. So they trick our bodies into starvation, and then they silently dismantle our hormones and our gut and our mental health. And silently and slowly, it actually hampers our gut and our brain, the connection that we have, the axis that we have, the vagus nerve, which is responsible for telling our brains that we are full and we don't have to eat anymore. It disconnects and it disrupts the balance, and that is why the body always thinks that we are starving, and the body always thinks that it does not want any food anymore. So I think that Ozempic and the drugs, so if, like, I would also ask you that if you do not have BP, and if I give you a BP medicine, will it be effectful for you, or will it harm you more? That is how, if you do not have type 2 diabetes, and if you are taking this drug just for weight loss, it has furthermore very harmful reactions apart from the benefits.
Anjali, you're the doctor here, would want you to explain to us and to our viewers especially that as Sakshi and Ishi have mentioned, they do have side effects. They obviously need to be used by patients, which is necessary. What are the real side effects which you want to point out where there is a loss of vision that is possible? What are the other side effects?
See, whenever anybody is going on a weight loss journey, there are going to be side effects, even if they are not on any appetite suppressant, because people generally will starve themselves. And a healthy weight loss is a very construed thing right now. Everybody wants a quick result and they want to look thinner every day. So the side effects of any weight loss can be muscle loss. It can be vision loss because you lose vitamins. It can be a gut dysmotility. You can get into constipation. You can have pancreatitis, especially with Ozempic, because Ozempic is a GLP-1 agonist and it's going to act around the enzymes that are produced by the pancreas. So when there is a drug that causes a GLP-1 increase in the body, then pancreatitis can happen. But then it doesn't happen to people who are doing it under supervision, because there is a certain way you have to eat when you're on Ozempic. And so according to me, the side effects are very variable. Okay. Very, very variable. And there is nothing which is so there is a risk versus benefit ratio when it comes to Ozempic. So if you need it, if there's a 140 kilo man who has really tried everything else, this can be a great help. But it's only a help.
So you mean to say if someone is doing it under proper supervision, with a dietitian or with a doctor, with consultation, it can actually help them a lot?
Of course it can help. It's a drug which the molecule, see, GLP-1s have existed for a very long time.
Yes.
But this molecule, every year they are bringing up a better molecule. So now we have 2 more drugs in phase 3 trials, like retatrutide, which will, of course, will not let the muscle loss happen. So as much as the natural weight loss is a great thing, that's the first option. But this is for people who have failed again and again and are not at the point where bariatric surgery can even be performed. So, for them, they're going to have osteoarthritis, heart disease, fatty liver, cirrhosis. So to save that, and also I must point out that in Ozempic and Ozempic-like drugs, GLP-1 agonists, we are seeing very good results at cellular level and mental level. So yeah, and these are researched articles present on PubMed, so we can all look at them and where you together with your doctor can make a decision whether you want to go for it or not. You should just, I think, read about the whole, let's not be focused on just media telling us, oh, it's bad or good. I think you have to take a personalized decision.
And I think what we need to really do is talk to experts about it, and that's exactly what we are doing here. Ishi, Anji has pointed out the traditional way of weight loss is actually a very long method of doing it. Therefore, people are wanting to go towards the drugs. What would your take be to somebody who's not really needed to be on Ozempic, would want to be on one? And also another thing, these are very expensive drugs. A single shot of the injection is about 3,500 for 2.5 ml, and then you have to go higher with intake because that's exactly how it helps.
Yes, absolutely. They're expensive drugs and they rob you of your health as well. So I would say, as a practitioner for the last 35 years, yes, we have been floundering around with calorie counting and carbohydrate counting and high fat, low fat, veg, non-veg, all that. And it's really not worked, and even now fasting has become very popular. But at the end of the day, I would say that when we today have the tools of intervening at the gut level, at the microbial level, we really don't need that kind of a drug. We just need maybe some insulin sensitizing drugs, which have been there, their safety has been proven, along with an anti-inflammatory, gut healing, personalized diet. Cannot compare, because at the end of the day, how many years are you going to be on this drug which is robbing you of your health? Let's put it very bluntly, it has to be a sustainable solution.
A sustainable solution is exactly what we need, and we are completely out of time. But
And
before,
safe.
yes, but before going, Sakshi, I just want to ask you. I know everybody here, be that a woman or a man, would want to know a diet, a quick diet to lose weight, because that's something we all would want. No matter what size you are, you want to get better than that.
Yes, definitely. So, yeah, I'm audible? Yeah. All right. So first I want to say that, of course, I want to just second the doctor there. And so when we are on any kind of drug, and if you're on it for a lot, or like a small period of time, like probably 3 to 6 months, and like the doctor has prescribed us, then we should know how to bounce back on our healthy lifestyle from it. If we do not know how to, do a lifestyle change, and we again go on our eating habits that we were on before, then the drug and everything that we have done on it will just go.
So ultimately, it's going to be a balance of both. So you can be
Yeah.
on the drug, but one thing you can't forget is what you eat. Be very sure of what you're consuming, what your mouth is taking. All the food that you're intaking is the most important thing.
And what you're not
Exactly.
eating.
Yeah.
That is also very
You know,
much.
I would just like to say that there are a couple of drinks that actually mimic Ozempic, and if you include that in your daily lifestyles, there's moringa powder. If you have that drink daily, empty stomach in the morning, it actually regulates your GLP-1, it regulates your insulin release in your body, and it acts the same way as Ozempic is doing. Then there's black jeera water. You just need to boil the seeds in the morning, and you have to have that water in the morning daily. Also, there's bale juice with some mint leaves and ginger. Boil everything together. All of these drinks are so natural and they're so effective in your weight loss programs. So even if you're eating regularly, eating in a healthy way, and you're including these drinks in your lifestyle, I don't think that any drug can be
So
more
I'm
beneficial.
sure everybody
yeah.
will be very happy. They've got a quick tip of how to lose weight and stay healthy. Thank you all for being with us today. And thank you all for watching this.